Hello and welcome to your next Break Journey free weekly video where I pick a topic related to birth and postpartum and I talk about it. This week we are talking about your relationship with your medical care provider, your relationship with your obstetrician or your midwife. And specifically, I'm going to give you 10 questions that you can ask your medical care provider to ensure that they are who you want to have helping you have your baby. I cannot overstate the influence that your medical care provider will have on your birth experience. Aside from your natural born physiology, the way your body is built and the way your baby's body is built, aside from those variables, your medical care provider will have the next most impact on your birth experience and the birth facility that you're birthing in. Both variables will have an impact on your birth experience. So it's essential that you know everything you need to know about your care provider and that your values and perspectives on birth are in alignment with their values and perspectives on birth. And let's switch it. Let's ensure that their values and perspectives on birth are in alignment with your values and perspectives on birth. I'm Carolee, I'm a birth doula, I'm a childbirth educator, and let's get started. So first off, there is no one right answer to these questions. There's no one right way to give birth. The answers to these questions that you want to hear are that your medical care provider's perspectives and values on risk and medicine and the birth process are in alignment with your own. And everybody watching this video is going to have a different perspective on medicine, on risk, on birth as a natural physiological process, and what kind of medical care that you would like to have. So it's essential that the answers that you receive, what we're looking for is, are they in alignment with your perspectives? And how are the questions themselves received? What is your medical care provider's response to you sitting there and asking them some, not tricky, you'll see these questions are not that tricky, but you're asking them questions about themselves. You are ensuring that the person that you want to have helping you have your baby and that the facility that you're planning to birth at is the facility where you want to have your baby. So if your medical care provider receives these questions with respect and respectfully offers you their own perspectives and thoughts and responses, then yay, yes. I mean, that already is a really good sign. If your medical care provider is defensive or irritated by your questions, if they're questioning why you're even asking them anything, because let's be real, there's a lot of ego that goes into medicine, whether you're a midwife or a doctor. Ego and personality are at play. So if they get defensive or aren't respectful of you or treat you like your time is not as valuable as their time, then that's a red flag. And I want to be clear, in our modern medical world, most obstetricians in particular and midwives in the hospital context do not have hours to sit and talk with you. That's just not the way their practice is set up. So to be real and respectful of their time, perhaps you end up asking these questions of you every visit, every prenatal visit. We have to be realistic, but also we want your medical care provider to be listening respectfully to you and answering your questions. And if now, hopefully early-ish in your pregnancy, they're not respectfully answering your questions, what's it going to be like if you are ending up facing some complications, or even if not complications, but just some complexity at the end of your pregnancy or as you're laboring? So if they're irritated by these questions now, it's just not a good sign, or defensive, not a good sign. So again, the purpose of these questions is to make sure that your care provider is in alignment with you and has the same values and perspectives around birth, and to ensure that they are respectful of you when you have questions like this. So let's get through these questions. I have the handout. There's a handout available for you. I'm going to make it available for you on my website. I'm going to go through these questions now, and I have them here in front of me. So the first question we have is, what are your beliefs, this is to the obstetrician or midwife, and philosophies about birth? And if they say they don't have any, that's not true. Every birth worker, whether a medical care provider or otherwise, has a belief and philosophy about birth. So what are theirs? How do they come to this birth experience, and what are their beliefs on this? The next question is, how much choice does the obstetrician think that you, the birthing person, should have in the decision-making process? So are they somebody who thinks that birthing people shouldn't be active participants in the birth room, or that as they are the trained expert that they should be making the decisions and just telling you about it? That's good to know now. If that doesn't match your perspective of you wanting to be the boss of the birth room, and and I have a bias here in that I really believe that it's your body, it's your baby, and you get to call the shots. So this is my bias, right? So if you ask me my philosophies and beliefs about birth, that you hired this person to help you have your baby, and you're the boss. They're the expert. They have expertise, and they have knowledge and training and years of education, and they have helped other people through this process, but you are the only one who knows what it's like in your body. And this is your baby, nobody else's, maybe your birth partner. But this is your body, your baby, your birth experience, so you get to call the final shots. That would be my perspective. But maybe that is not yours, so obviously, here's my bias. Next question. What are your thoughts? This is you asking the OB. What are your OB's thoughts on pain management in labor? If you as the birthing person are going into your labor saying, I think I'd really like to have an epidural unless for some magical unicorn reason, which sometimes it happens, I have a really quick and easy birth. Maybe you're going in saying, I do not want to use pharmacological pain relief, an epidural or otherwise at all, if I can at all avoid it. I have this reasons, lots of people have lots of different reasons, and this is your perspective. If that's your perspective and your medical care provider says that they hardly ever help anybody have their baby who's not on an epidural, that's a misalignment. Similarly, if you are wanting to birth at a birth center that doesn't allow epidurals at all, and you're talking to your midwife saying you'd really like to have an epidural in your labor, that's not in alignment. You can't birth at a birth center and expect to have an epidural. You'll have to be transferred to the hospital. So these are the reasons you ask these questions. There's not really a right answer. You just want to make sure you're in alignment. Let's see, the next question to your OB. What are the routine policies and procedures in your practice, in the OB's practice, or at the birthing facility? Now, obstetricians and midwives have to follow the practices and policies of the birthing facility as well as their own practice. So the birthing facility may have an expectation that every single birthing person that checks in is on an IV. They may have an expectation that every single birthing person that checks in is on continuous fetal monitoring. And in the Brave Journey Birth Preparation Program, the full program, we go through all of these interventions and talk about the benefits and risks. And the benefits of continuous fetal monitoring outcomes are the same as intermittent monitoring if you are a low-risk birthing person. So if you're automatically going to have continuous fetal monitoring, because that's a facility's policy, that's something to be at the very least aware of, so you can modify your expectations, or you can start shopping and looking for a different medical care provider. This next question to ask your medical care provider is, when do they typically recommend induction? And this is a good time to start talking about induction. You want to be thinking about this early in your pregnancy, because it's something, what was the data? It's such a high percentage of birthing people by the end of their pregnancy are facing discussions and recommendations for induction from their medical care providers. So this is likely something that you will be navigating. It's a high likelihood. So it's good to know now, what are your medical care providers' perspectives on induction, and when do they normally recommend an induction? Similarly with the cesarean, ask your medical care provider, what is your cesarean rate? This is a valid question. If they don't know or they can't tell you, you can look it up somewhere, do the research. This is an important question. There's been a lot of studies out there that will indicate that your medical care provider's cesarean rate will impact your likelihood of having a cesarean. So in our country, 25% of low-risk birthing people gave birth via cesarean in 2020. But if you're at a birthing facility where they have a much higher cesarean rate, your likelihood is higher than that, if that makes sense. So ask, just talk about it. Make sure you're in alignment. This is just a really important thing to know about your medical care provider. Next question, family-centered cesarean practices. What family-centered cesarean practices are available in your obstetrician or midwife's practice and at the birthing facility? So a midwife wouldn't be performing the cesarean, an obstetrician would, but sometimes they're shared practices. So what are the family-centered cesarean? And I can refer you back to a former episode on family-centered cesarean practices. Whether or not you will be birthing via cesarean, it is on all of us to ensure that every single hospital in the world, but I can focus on the United States because I'm here in the United States, provides family-centered cesarean practices. These are simple. They have nothing to do with medical risk. It's just culture in the hospital, and they can have a huge impact on a cesarean experience. So it's important to know which of these are available in your birthing facility, and if they're not, to start advocating for it now. And I have some former episodes on that. We also talk about this at length in the Brave Journey Birth Preparation, the full course. Next question, how do you typically manage the third stage of labor? So this is asking your medical care provider, how do they manage pushing? Now, some medical care providers really like to coach people in what's called provider-directed pushing, which is where they'll count and tell you when to push and tell you when to breathe and just count like 1, 2, 3, 4, push, 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 inhale, push, 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 try to get 3, sometimes 4 pushes a contraction. That's provider-directed. Birther-directed is where you push based on your own internal sensations and often are exhaling and breathing normally, versus the provider-directed often will invite you to hold your breath and push the energy downward. So just find out, what does your provider generally do? Most providers have helped people push their babies out a gazillion times in their career. That's a very specific number. But they're going to have a way that they like to do it. So it's good to talk about and just know. Next question. This is a tricky one, and you may want to just save this one all on its own for if you have short prenatal appointments. But how does your medical care provider address and resolve the traumas that they witness on their job? Now, when we're pregnant, we may not want to think about this too much, so manage your own triggers. Recognize that your medical care provider is grappling. Birth and death are intertwined, and your medical care provider is likely witnessed trauma on their job. And it is important for you to know how aware they are of that in themselves and how they resolve that and what practices they have in place. Because this is going to impact how capable your medical care provider is of being present with you in your actual circumstances versus their heart and mind and body being caught up in the trauma of a birth they just attended down the hall 5 minutes ago. It's hard, and I say this with a huge amount of compassion, and as a former trauma worker myself, it's hard. This is a really hard question, but we should be asking this of everybody in the medical field to ensure that when they are grappling with trauma, they're not carrying that into your room, because they may be more likely to see and react with fear or emergency, anxiety and rush and this kind of energy, which is just the opposite of the necessary energy of birth. Birth needs steadiness, confidence. We talked about this when we talked about the hormones of labor. So really just be aware of where your medical care provider is with this. And then the last of the 10 questions, it's pretty logistically clear. Who is your medical care provider's backup, and will you get to meet them? So in all likelihood, this person you're talking to in your prenatal appointment isn't necessarily the person who's going to be there at your birth, unfortunately, especially if they're in a group practice. So you want to know who the other people are, and you want to be talking to those people too. If you're in a small practice, you'll have a chance to get to know people more. If you're in a larger practice, then you'll have a lot of people to try to get to know. But it's important to know, who is your medical care provider's backup, and will you get to meet them? So those are the 10 questions. Now, what do you do if your medical care provider's answers are not in alignment and a whole bunch of them make you concerned? Well, you have 2 options. One is to go shopping and find a different medical care provider. And sometimes that's easier said than done. Sometimes because of your own financial limitations or your limitations in your insurance, or simply being in an area that doesn't have very many medical care providers or options, you may not have very many other options. And it may not be easy to shop for another care provider. I've tended to work in areas like San Diego County, Phoenix, where you have so many medical care providers to choose from, that the second you don't like the one you're with, you should just go bam over and find another one, because this is so important. But I know it's not that easy for some folks in other places or with limited financial means, and I want to acknowledge that as somebody who was completely limited by my own insurance situation when I was having my first baby. That's your first option. Go shopping, find another medical care provider. Your second option is to start now. The second you're seeing these red flags, to collaborate with your medical care provider in creating a birth plan together. I'm using the words together. Collaborate, work with. So this is a time where you're like, oh crap, we are not on the same page and I don't have any other options. So your other option is to try to collaborate and work with your medical care provider to come together to some sort of an agreement, to make it clear what your, as a birthing person's, perspectives are on birth and risk and the way that you'd like to approach this, and to hear where your medical care provider is coming from and try to find some middle ground. And this is why in the Brave Journey Birth Preparation Program, we have a whole section on birth plans and templates, because your birth plan is a living document, is a working document, and it's a way to create a plan with your medical care provider. You work on it through your pregnancy together, so that by the time you walk into your medical care facility in labor and you hand it to everybody in the room, you've already talked about it with your medical care provider. These are just reminders. And so you can use your birth plan in creating this collaborative process, but that's the harder road. I'm not gonna lie. That is the harder road, but I fully acknowledge that some people don't have a choice. So if you're seeing a lot of red flags, your two options: go shopping or collaborate and work out a birth plan together and try to find some middle ground. Okay, so that's it today on our discussion about your relationship with your medical care provider and 10 questions you can ask to try to determine whether your medical care provider is the person that you want to have helping you have your baby. Thank you for listening, and I will see you next week.